So today we're going to do a little preview, a review preview of Juvederm Volure. So this is the newest filler from Juvederm. This is one of their Generation 2.0 cross-linking technologies. The original Juvederms, which came out, it's a good 10 years ago now, maybe longer, they were cross-linked one way. This is crossed a second. We call it Violet Cross technology. These fillers, which consist of Voluma, Volbella, and Volure, they vary in only how thick they are. So the Volure is kind of in the middle. It's the middle thickness. Volbella, which is for the lips, is really dilute and it's really soft. Voluma, which is for the cheeks, really hard. Shouldn't say hard, really stiff, really firm. It's better for building bone. This stuff, though, is perfect for nasolabial folds. So a lot of times when new fillers come out, we always, this practices say, why should we bother with even picking up a new filler? We already have literally 12 others. The promise of Volure is an 18-month indication. So this has been proven with optimal correction. What optimal correction means is if you need 2 or 3 syringes, you actually do 2 or 3. You don't take one and try to fake it. But with optimal correction, people keep their correction for a 1.5 years. So that is what's new about this filler. So Juvederm Volure. It's also got 2 other properties which are interesting. One is it's not really tight, so after a few weeks it kind of blends in. It doesn't hold a real crisp shape, so that's perfect when we don't want to see a ridge or a lump under the skin. And the last property, which is kind of interesting about it, is it's fully hydrated. And what that means is, unlike Juvederm, which had a tendency to swell, not just immediately, but even a couple months or several months later, sometimes we'd see Juvederm swell and get boggy. Juvederm Volure is fully hydrated, and so it's not very hydrophilic or hygroscopic, whichever word you want to use, so it doesn't draw water, and so those are the new things about this filler. As with all new kind of 2.0 technology, it's a little bit pricier, but not bad, and when you consider the 1.5 year indication and the better results, I think it's a pretty good deal. So we're going to do a syringe for Jen today. As you can see, she needs basically nothing, but nasolabial folds are perfect, so that's what we're going to do. So the cannula technique is I make 2 little pokes with the needle first, and then everything else is done with a little non-sharp tube, and it minimizes bruising really dramatically, which is great. 2 pokes, here's one. So right here's the other. And that's it, that's all we use the needle for. And everything else is done with this cannula. So a cannula is not sharp. It goes through the little doorway that I made. And then I use the cannula to lay in the product. So for people who are going to be injecting this stuff on their own, one thing to know is that Juvederm Volure is kind of like Volbella, real soft, it's extruding force minimal. You can't push as hard as you would if you're going to use Juvederm Ultra or Juvederm Ultra Plus. This stuff just flows out of the syringe, it's almost like water. Okay. Now, turn back just a second, open your mouth for me, and I'm going to do a little bit of molding. So with all fillers, we generally tell people I'm not worried that they're going to distort it or displace it with pressure. Close, mold, really good pressure. But you can mold them just a little bit at the beginning. Open for me. The pressure really doesn't change fillers. I worry about pressure with Botox and Dysport, the muscle relaxers. With fillers, I really don't worry about pressure. So we tell people they can ice if they want to. I don't think it's really necessary. I do think holding pressure for the first couple minutes minimizes the chance of bruising. And a lot of that just depends afterwards, from that point on, kind of what the patient wants to make of it. Some patients want to make an experience, so they'll sleep with their head elevated, they'll ice the first few days, they won't exercise. And other patients say what really matters. In my opinion, I don't think any of that really matters. It's just the pressure the first few minutes, and that's pretty much it. Not too bad?
No, that was great.
Good. Thank you for being our guinea pig.
Of course, always.
All right, thanks.